Well, I talked about extended adjuvant hormone therapy, which is a unique question in and of itself. What we understand about hormone receptor positive disease, endocrine sensitive hormone receptor positive disease, is that there's substantial risk of recurrence after 5 years, and that risk lasts till 20 years or greater. There actually was a meta-analysis that has been presented and will be published soon from the Early Breast Cancer Trialist Group, looking at many trials. 46,000 women, 92 trials in women who had received 5 years of hormone therapy, most tamoxifen, and they looked specifically at distant recurrence after 5 years. And they actually reported very high numbers relatively, 14% for node-negative disease and up to 47% for 49 positive nodes. Whether or not that's really exactly what we see remains to be questioned. I think these retrospective meta-analyses where some patients are lost to follow-up and the ones you see the most are the ones that recur, I think, it's until we see all of the detailed data, it's hard to know. Plus, treatment has changed over time and the aromatase inhibitors have entered into the scene. From the current trials, it looks like there is still ongoing recurrence, but that those rates are lower than what seemed to be seen in that meta-analysis. Be that as it may, we know patients are continuing to relapse, and I think the idea is how do we best attack that? I think in terms of forward thinking, we're doing randomized trials now looking at cyclin-dependent kinase inhibitors, and there will be at least 15,000 women randomized on adjuvant trials adding a CDK4/6 inhibitor to hormone therapy or not in the next few years. So we'll see something about whether or not we can impact short-term outcome, but it'll take forever to see the long-term results of those trials.